Hi everybody, I hope this finds you well. I'm coming to you from a sunny Lanarkshire again this week, which is always good news. To get some sunshine on your days off, I think just gives you that added benefit, doesn't it, at this time of year. I'll start off as I usually do by talking a bit about the numbers, and then I'm going to say a wee bit about the policies around isolation for staff who have been identified as contacts by test and trace. And then I'm just going to finish off by talking a wee bit more about our GPs and the pressure they're under. So to start off with, the numbers that we've seen yesterday, 352 new cases being reported yesterday, with 73 patients now sadly in our inpatient facilities, and 2 patients in ITU and 2 patients on CPAP. And a bit worryingly, we now have 4 outbreaks in care homes in Lanarkshire, and of course even with the 2 vaccinations you're not completely protected, we know that from COVID, and we've seen sadly some patients and staff being infected in care homes over the last week. So a really strong message to just keep taking all those protections that you need to take to keep COVID at bay. In terms of pressures on the system, last week I took the unusual step of doing a public video as well as a staff video, which some of you might have seen, just to really share with the public my concern about the pressure on staff because of the combined increase in emergency attendances, the increase in COVID numbers at a time when we are trying to remobilise our services. The feedback on Facebook from that message, there was some positive feedback, but there were a lot of comments about GPs, and I think it is important to realise, I understand people are having difficulty accessing their GPs at the moment. Please bear with them because their activity's gone up too. Their activity's up by about 30% compared to where they were at this time last year, so they're struggling to cope as well. So just please bear with them, and you will be seen and you will get appointments, but just hang on the phone and you'll be dealt with. Something else I wanted to just mention to staff this week is around those staff who've been asked to self-isolate. One of the reasons we've got workforce pressures is because around 60 staff on any one day across Lanarkshire are self-isolating because they have been contacted by Test and Protect. I'm working closely with colleagues in public health at Scottish Government to see if we can put in place a policy which would enable our staff to come back to work with the relevant protections to contribute to maintaining patient services if they are not a household contact. So hopefully you'll see something being issued over the next 24 hours around that, and that would enable people with regular testing to come back into the workplace with PPE. So watch this space, that should be issued shortly, and I hope that will help with the pressure that we have on workforce. Finally, I just want to say something about kindness. I went to my normal swimming pool last night and I met a lady outside who was going in, and she said to me, "Oh, I'm quite nervous. I haven't been swimming for a long time." She hadn't actually been swimming since the part of the pandemic, and she was asking me, where do you go, when do you wear your face mask, when do you take it off? And I think it's very easy to forget that people are still quite scared and apprehensive, and just a bit of kindness goes a long way at the moment. So that's my final message for you today, and I hope you enjoy the rest of your week and have a great weekend when it comes.